Did you know that a doctor's ability to understand your culture could literally be the difference between life and death? Dr. Frederick Lee II, emotional intelligence practitioner, executive coach, consultant, and speaker. One of the clearest lessons from my dissertation was this: cultural competence saves lives. Cultural competence is more than awareness, it's the ability of healthcare providers to deliver care that respects and responds to a patient's cultural background, beliefs, and their lived realities. When cultural competence is absent, the consequences are devastating. Women told me about providers who dismissed their spiritual practices, ignored their communication styles, or assumed they wouldn't follow through with care. One participant said, "They acted like I wouldn't understand, so they didn't even explain." That assumption stripped her of the knowledge she needed to make informed decisions about her breast cancer care. Statistics show that patients who feel their culture is respected are more likely to trust providers, follow treatment plans, and report better health outcomes. On the other hand, lack of cultural understanding widens these disparities, especially for Black women who already face systemic barriers in care. One woman described how her provider rolled their eyes when she mentioned prayer as part of her healing process. Instead of dismissing that belief, a culturally competent provider would have seen it as an opportunity to connect, to honor her values, and to strengthen her resilience. Cultural competence is not political correctness. It's medical necessity. It acknowledges that healthcare doesn't exist in a vacuum. Patients bring their identities, traditions, fears, and strengths into the exam room. Ignoring those realities doesn't make them disappear. It makes the care less effective. And here's the truth: cultural competence benefits everyone. It doesn't just help patients of color, it improves communication, reduces misunderstandings, and builds trust across all groups. So when providers meet patients where they are, everyone wins. Here's how you can advance cultural competence today. If you're a provider, learn your community. Take time to understand the cultures that you serve. If you're a patient, speak your truth. Share your beliefs, practices, and preferences. They are part of your care. And as a community, demand training. Advocate for hospitals and clinics to implement cultural competence as a standard. In the comments right now, what's one cultural practice or belief that you wish healthcare providers understood better? Let's build awareness together. I'm Dr. Frederick Lee II, and this has been your lesson in life.